Hi, my name's Michelle Gellis, and I would like to thank the American Acupuncture Council for giving me this opportunity to speak to you today about microneedling for hair loss. Go to the first slide. A little bit about me. I am an acupuncture physician. I am the author of this book called Treating the Face. It is a comprehensive guide. Thank you. Wait, this way. And back a little bit. Okay. It is a hardcover, 500-page full color book with over 350 images in it on treating the face. And there's an entire chapter in this book on microneedling, so you might want to check that out. And I teach cosmetic and facial acupuncture classes internationally, and I am currently on faculty at Yosan University in Los Angeles, California. So, what is microneedling? Microneedling creates microchannels in the skin, and these microchannels will trigger cellular repair and regeneration. It helps to stimulate collagen and elastin and growth factors in the skin, improves the blood flow to the skin and therefore nutrient delivery. It enhances the absorption of any topical products that are put on the skin, and therefore it is used for skin rejuvenation for things like wrinkles, scars, pigmentation issues, and what we're going to talk about today, hair growth. This is what a microneedle pen looks like. This particular one is made by Aculift, and you can see the website on the slide there, aculifskincare.com. And these have a dial here, and this determines how deep the little needles on this cartridge will go into the skin. And this little window here, it determines the speed, how fast those needles are going in and out of the skin. And this is what the needle cartridges look like. These are the 16 pin or 16 needle cartridges that would be used for microneedling the scalp. And I did want to talk to you a little bit today about hair loss, different types of hair loss. There are a lot of different reasons why we lose our hair. And this quick 10-minute lecture I'm giving you today is part of a much longer 1 hour CEU lecture that I give, which goes into all of this in much more depth. So this is kind of an overview, but some of the more common types of hair loss are androgenetic alopecia, which is commonly referred to as male pattern or female pattern baldness or hair loss. Telogen effluvium, which is typically from stress or illness, if your hair falls out. Alopecia areata, which is an autoimmune disease. Scarring alopecia, which is an irrevocable follicle loss. There are other hair shaft abnormalities. Anagen effluvium, which is a rapid hair loss resulting from some sort of a medical treatment like radiation or chemo. Tinea capitis, which is ringworm in the scalp. And hypotrichosis, which is just naturally sparse hair or reduced hair growth. Now, microneedling is good for some of these and not for others, but I just wanted, for purposes of today, I just wanted to give you kind of an overview on some of the different types of hair loss. Within the TCM framework, hair loss um, can mean reduced follicles, whereas hair thinning is the reduced shaft, the caliber of the hair shaft. And we have several patterns that we look for. So, Qi and blood deficiency, damp heat, liver kidney deficiency, these are all different patterns that can show up with hair loss, with microneedling. I'm sorry, for hair loss that microneedling can be effective for. So you want to address the root with body points and then do some local scalp therapy with the microneedling. So you do your acupuncture body points and then you would do the microneedling locally. And so blood heat generating wind pattern might show up as itching, headache, red tongue, and the treatment would be to clear the heat, extinguish the wind. Qi and blood deficiency frequently are post illness or postpartum, and your patient may have fatigue, pallor, weak pulse, thin hair, and the treatment would be to tonify the qi, nourish the blood. For damp heat, this is often diet related. They might have a greasy scalp, loose roots, itching, red tongue. So you want to clear the heat, resolve the dampness. And for a liver and kidney deficiency, this can happen in middle-aged individuals. They might have dull or graying hair. So microneedling can actually help the hair to not be as gray as well. They might have sore back, knees, dizziness, uh, red tongue, thin coat, thin rapid pulse. So you want to nourish the liver and the kidney. And of course, within Chinese medicine, mental and emotional factors can play a role in hair loss. So stress, grief, and worry can cause hair loss. So how does microneedling support the hair growth? Well, microneedling, as I said, stimulates the collagen production. Also, when you create these little micro injuries, it triggers cytokines and regenerative cycling in the skin. And this can help with the hair regrowth. It enhances blood circulation. It, as I mentioned, improves the absorption and transepidermal delivery of any topicals that you would put on your scalp, whether it's a medical topical like something like minoxidil or some sort of a peptide or growth serum. It can thicken the existing hair and enhance the overall scalp health, making a more better, more fertile place for the hair to grow. And it can activate some, if the person has a hair follicle, it can activate the dormant follicles, promoting new growth. It also releases growth factors. And in my longer lecture, I get into what all of these different growth factors are. And these can help with all of the above concerns. So within Chinese medicine, the way we think of it is microneedling promotes qi, blood, and collagen renewal. And stimulating the scalp works with microcirculation for the follicle vitality. So again, activating stem cells, enhancing this microcirculation, and creating collagen production can help to thicken the hair and enhance the overall scalp health. So, the equipment that you need is a professional microneedling pen, especially if you're working in your office. You don't want to get a commercially available pen. You want to get a professional microneedle pen because the speed will be calibrated properly. The pen itself should have anti-backflow technology. The needle should come in single-use cartridges, and then serums that are appropriate for hair growth, things that contain growth factors or peptides, botanicals, and you will prep the scalp with witch hazel or alcohol to cleanse it. You're going to need gloves. You're going to section the hair, and you could put topical anesthetic on and then put on a disposable, like a shower cap, for like 15 minutes. You can even use blue light if you have a blue light device. So you want the basic treatment flow is you meet with your patient, you're going to pre-screen them for any contraindications, and go through a treatment plan. Typically, you're going to see them once every 2 weeks or so, and you're going to cleanse the skin, apply numbing cream, then that has to come off, and you would section the hair, whatever hair is there, and you're going to apply serum. You're going to set the depth on the pen, depending on where in the scalp and other factors. It's either going to be 0.25 to 1.0 millimeter, and then you'll either do a linear or a stamping motion. You could use red light afterwards to help to increase the blood flow. And then you would set up aftercare with the patient, tell them what needs to be done, and then you could see them again in 2 to 4 weeks. Typically, improvement is seen within 8 to 12 weeks, and that usually looks like enhanced density and reduced shedding. And you want to make sure that you are following clean needle techniques. You're going to use gloves. Your hands are going to be clean. You would have a clean field set up. You definitely want to use single-use cartridges, and they are put into the sharps afterwards. And you want to record the depth of the needle, how many passes you did, if you used an LED light, how much time, and what the response was. And then, of course, document with before and after photos. So here are a couple of before and after photos from patients over about 12 weeks. And as you can see, the density was quite significant, density change in this patient's hair. And the first one was taken, if you're wondering why the hair color was different, this was taken in the beginning of the autumn after the summer, and then this was taken 12 weeks later. And after some haircuts, all of the blonde had kind of grown out after a few months. So, and this is another before and after. Again, significant changes in this bald area. So if you want to learn more, on my website, facialacupunctureclasses.com, you can get a copy of my ebook on microneedling. And I also offer several different classes on microneedling for anti-aging, acne, hair loss, and I also teach live hands-on classes around the country and around the world. But the online classes do have live they have demos, and they're all approved for continuing education. So you can visit facialacupunctureclasses.com. And if you want to learn more about the products, go to aculiftsskincare.com.